I tip I typically forget that. So you know what? Sometimes you have to celebrate the small things. So I'm celebrating the fact that I remembered that on my own this time. We definitely have a small group today, and that is perfectly fine because then we can have conversations and, kind of brainstorm ideas with one another, and that's awesome. But I'm still going to kind of go through some of the slides and everything to make sure that for those that are going to be listening to the recording later, that they will get the full content of it. So again, welcome. Thank you for taking the time to join this call. I don't know what your day's been like, but we're heading into a holiday weekend and sometimes gets a little crazy at work when that happens. And thinking of my audience, healthcare, sometimes you might not even get a holiday weekend. So, so I know that I just finished having lunch. I hope everybody that's on the call today has had time to, squeeze in a quick lunch at least. Excuse me. So my name is Jody Bias, and I am one of a fabulous group of technical assistance project managers here at the UCF Center for Community Schools. You may or may not see me as a familiar face. I am going to go ahead and let my team introduce themselves. Um, I don't know if Dr. Rollins is on the call. Dr. Rollins, are you able to introduce yourself?
Yes, I'm here. I'm Dr. Tawana Rollins. I'm over cohort 1.
Thank you. Cohort 1, in case you're not familiar with that language, Cohort 1 is our OGs, our original set of schools that came into the Community Partnership School Network. And I forgot to mention that I'm over supporting Cohort 2, and those are schools that have been around the like 5 or 6 year mark of implementation. And we also have the lovely Justine Jordan on the call. You want to introduce yourself?
Yes. Hello, everyone. My name is Justine Jordan. I am the program manager for cohort 3. And just to give you uh, an idea of what that is, it's usually our school sites that are in year 2 and 3. So a lot of them are going through their readiness assessment with certification. So that's what I see in my cohort. I'm so happy you are all here. And we know the end of the school year is pretty busy, but I'm excited to hear any other things that might be going on at your sites.
Thank you so much. I am going to jump and look at the agenda real quick, but basically, we'll get through the business part of the meeting as always, and then we are going to be talking today about strategic planning. So at community partnership schools, strategic planning tends to happen with the cabinet over the summer months when school's out of session. So you may or may not have been hearing conversations about when strategic planning will be scheduled and happening with your cabinets. Which if you're part of the cabinet, you will be part of those conversations. So we want to just bring you some information that will help you prepare for it and guide you into it so that you feel ready to share all of your wonderful ideas. So that's basically the content for the meeting today. We ask that, of course, as much as you can, to be present, to be engaged. Like I said, it's a small group today, so please feel free to unmute yourself at any time to share ideas, to talk with your colleagues that are on the phone. I'm assuming one of the big reasons that you join this call is so that you can hear from other healthcare partner stakeholders from across the state, get ideas, share ideas, think about best practices, think about things that you can incorporate that, maybe some other sites are doing that you hadn't thought about doing. So, be engaged and be present in this meeting as much as you possibly can. And just as a reminder, within a week or so of this call, we try to do it within a week, we will be sending out what we call the circle back. And that is our way of getting the information from this call back to you. So you'll get a MailChimp email, and it will have the recording of this call. It will have all the links or any resources that were shared in this call. So you don't have to take notes if you don't want to, because all that information is going to be coming back around to you. If you are not receiving the MailChimp circlebacks, that means that we probably don't have you on our email contact list. And we want to keep that as up to date as possible so that you can benefit from all the wonderful resources that we're sending out periodically. So if you don't receive that, please make sure that you jot down our contact information, and you can email us and let us know that you would like to be added to our email list for our healthcare partners. We will share our contact information on the very last slide, and you can contact any one of us and it will get to the right place. So if you're not receiving that, make sure that you let us know. All right, so I think we have a small enough crowd that if you don't mind, I would love for you to unmute yourself and introduce yourself and let us know what school you're connected with and what organization you're from. And I am just going to go in the order of what I see on my screen. And I'm just going to have to go by what the name says. So I apologize, and I don't want to put you on the spot. If you can't unmute or the technology is not working for you, just let us know. You can put your information into the chat. So I am going to start with T. Tyson. Do you mind unmuting?
Course. I am Tiara Tyson. I am with Orange Park High School. And I am new to this call.
Oh, wonderful. Well, thank you for joining us. I'm glad that means that you're on a mailing list somewhere for us.
Yes, somewhere, yes.
Yes, yes. And strategic planning this is probably going to be your first time going through strategic planning. Is that true?
No, I've heard it a couple of times. I've been doing this with them for 2 years. I skip organization. I do work for Palms Medical Group, FQHC here in Clay County.
Okay, well, thank you for joining the call. We welcome you. And I see the next person is, I'm butchering these names, so I apologize, but it's C. Schlitt, I think.
Yeah, hi, thank you. It's Cheryl Flickta. You did very good. I appreciate it.
Sure.
I'm sorry, I do not have my camera on today because I have a terrible cold. So, but I am with Lee Health in Fort Myers, Florida. And the schools that I work with, which I absolutely love, are Fort Myers Middle School, Franklin Park Elementary, and Colonial Elementary Schools.
Okay, awesome. Thank you for joining us. Have you been through strategic planning before?
I went through one session last July with
Okay.
That was my first experience, and it was interesting.
Okay. Well, everybody does it a little bit differently. So hopefully you will, hear something today that you can bring to your strategic planning session and, add to the value of it. I'm sure that you will be able to. So thank you again for joining us. The next person on the call is Laura Spencer.
Hi, yes, Laura Spencer. I'm with Aza Health, and we partner with 2 schools. It's Wilkinson Junior High and the Keystone Heights Senior High School, both of which are in Clay County.
Awesome. Thank you very much. And have you been through strategic planning with your community school?
Oh, yes, they're both certified or whatever it is, and they've been doing it 4 or 5 years. So I've been to an original partner. So I've been on many strategic planning sessions for both.
Awesome.
Even in the same county, they still both do them differently. So
yeah, for sure. I am so thankful that you're on this call and you can share your expertise and your experience, having been through it many times with a couple of different schools and bringing that variety, but also bringing that experience. So I can't wait to hear some of your ideas later. Thanks for joining the call. The next person on my screen, Caitlin Wilson.
Hi team, Caitlin Wilson Butler here. I support HCA Florida Ocala Hospital and HCA Florida West Marion Hospital. Together, our hospitals support College Park Elementary, which is a United Way partnership school here in Marion County, Ocala, Florida.
And have you done strategic planning with any of the schools?
I have, yes. I don't lead it, they lead it, but we're there in a support role.
Awesome. Awesome. Thank you for joining. And I believe, unless I missed somebody, I believe the last person, but of course not least, is Christopher Watson.
I'm actually at work. I will talk to a resident real quick, so give me a second.
Absolutely. Just go ahead and put it in the chat when you're able. So you can do it at your convenience. Okay, so that is everybody who's on the call. And I'm going to go ahead and get us started on the strategic planning talk. It sounds like we have a whole lot of experience in the room. So why is strategic planning important? Anybody want to put in the chat? What are your thoughts? Why is strategic planning important? So as you are putting your thoughts together and putting that into the chat, why you think that strategic planning is important, I'm going to go ahead and talk about why I think strategic planning is important. I love that strategic planning is a way to help keep me on track with my time. And also it helps to be very intentional in order to reach your goals. So we have all worked for organizations that, were super busy. And I don't think that ever really stops, no matter what the organization is. We're all super busy. And, you can get through the end of your work day, but you can also get through the end of like your first quarter or halfway through the year and realize that you really thought you would be a lot farther along in terms of the goals that you were trying to meet. So strategic planning for me helps to make sure that I am intentional about the goals that we want to reach. And that we're efficient with our use of time because of the progress monitoring that kind of goes along with the strategic planning. So, and the intentionality, the efficiency of time, I don't know that I could reach the goals that we have in place if we didn't, have the strategic planning process. So the cabinet, the Community Partnership School Cabinet, has a set of priorities. One of the priorities is strategic planning. They're also, in charge of and having conversations all the time about the fidelity of the model and the sustainability of the model. And, if you are one of those schools that's coming up on certification evaluation, they have lots of discussions about that. But a lot of what drives all of that is the strategic planning. And there should be kind of a through line of the needs that have been identified from the needs assessment and the asset mapping, and then talking about, okay, we know what the needs are. How are we going to turn those needs into really strategic goals? And then how are we going to create the goals so that we can monitor progress and make sure that we are moving in the right direction and doing what we need to do to help our students and our community. So strategic planning is super important. For those of you, I think everybody has been through it on the call, but as a reminder for anyone that watches this recording that hasn't done strategic planning, it is a process of kind of, like I said, defining the organization's goals and then identifying what the resources are going to be needed in order to achieve those goals, and then really developing a plan. Sometimes not all of that happens in the cabinet, but the cabinet is really, the 30,000-foot view to kind of set the tone for what the goals are going to be, so that the other pieces of the puzzle, like maybe the operations committee, some other core staff, are going to really talk about, okay, the ins and outs, the details, boots on the ground, how are we going to make this work? But it all starts with the cabinet. So like I said, your cabinets are going to be having a strategic planning meeting sometime over the summer, typically. Sometimes the strategic planning is this is the year we're setting the strategic plan for the next whatever 2 or 3 years. Sometimes you're gathering together and you're just reviewing what the plan is, looking at the data and tweaking the goals a little bit, but not creating an entirely new plan. But you're going to be coming to the table and having discussions to kind of set the tone for the next of the year. What I ask of you as our healthcare partners is to really help the schools dare to dream big again. Sometimes we can get, and like we all are this way, especially after we've been through strategic planning discussions a couple of times, we can kind of get in the rut of the same ideas over and over and over again and just, rinse and repeat. So I ask you to like really think about what we're going to be talking about in this meeting and think about like what are some big ideas that you can bring to the table and kind of open up the minds of your cabinet. Even if it's not something that can be implemented, it's always good to look at those ideas. So I am seeing here that my screen is not showing everything it should be showing, but that's okay. So we are going to use a Padlet. So there is a QR code on the screen. So if you want to use your phone, you can use your phone to open up the document. Or Justine has graciously put the link into the chat. So I'm going to give you just a couple of minutes to switch over to the Padlet on your screen. And the way that you're going to answer is that you are going to find the little plus button in the bottom right-hand corner. And if you click on the plus button, you'll be able to answer the different questions that are on the Padlet. So let's see if I can pull that up on my screen. This is really testing my technology here. So let's see. All right. So, Justine, would you give me a thumbs up if you can see the Padlet screen now? Perfect. Okay, so there is a plus down here at the bottom of the screen, and if you click on that plus, you'll be able to answer, and let's stick with the first question. What do you already know about strategic planning? It sounds like a lot of you have been through it before, so just put a quick note about what you already know, and then definitely I want to have you click in and respond to that middle column. What do you want to know? And we can talk about that, or we can have your colleagues on the phone talk about that too.
Sorry, Jody. I thought you meant, can I see it on my screen? We don't see it on yours.
You don't?
No,
Okay.
I think you just have to click on the Padlet that's right there. We see all the other ones.
You see all the other Padlets, but not this one?
Correct.
That's really interesting. Okay. Let's see. You know what? I'm going to figure this out. I am going to challenge myself to get this figured out. Okay. Share. This screen right here. Do you see it now?
It's loading. Yeah, we see it.
Perfect. Okay, see, I can do hard things too. That's why I just keep telling myself. All right, so now that you see it, but you should be able to have clicked in, and I do see that there are some people already joined in. So go ahead and answer a couple of questions. We'll take a couple of minutes and move on from here. All right, so what do we already know? I'll just read out a little bit of what I'm seeing. Yes, we are going to review the progress on the current plan. We are going to take a look and eyeball the needs assessment, see if we need to review anything that has been that has changed in terms of the needs or the assets. Sometimes we get like new assets that come into the community or into your healthcare network, into the school. So we're going to take a look at that. And then you are going to set new goals and objectives, or you're going to update or tweak old goals and objectives. And if you don't want to type into the Padlet, again, just feel free to unmute yourself. But what would you like to know about strategic planning. Are there any burning questions that you would like for us to answer so that you go in fully prepared? Health objectives for the school. So there's a question about how often is it required? You know, that language of required gets a little confusing, but is required every 2 to 3 years. And there's some leniency in there because there are things that can be substituted in terms of certification, but every 2 to 3 years you should be creating brand new goals. All right, so I am going to click off of that, and then unfortunately, I don't know. Okay. Bear with me. And I will click back over to the presentation. Okay. All right. All right, let's see. Boy, you know, see what happens when you have lunch late? All right, let me get back to the presentation. All right, so we are going to talk about one of the things that if you've been through this before, you probably already know that everybody's bringing data to the meeting, right? So when you're thinking about preparing yourself, let's see. All right, are you seeing my full screen?
No.
No.
No. Well, I apologize. Let's see. Let's see. Screen 3. Okay, now I got it.
Now we can
Okay.
see it.
Yes.
Perfect. Thank you. Okay, so everybody's bringing data, right? The principal is going to be loaded up with all kinds of data about academics, about attendance, about behaviors. There's going to be a lot of data being brought by the community school director in terms of what the goals were last year, how they made progress on that goal this year. So I wanted to kind of pick your brains and have you guys share with one another when you come to strategic planning, what kind of data either have you brought in the past, or if you haven't, you know, really thought about this much, what kind of data kind of flows through you as a healthcare partner that could be helpful for strategic planning for the community school. So be brave, unmute yourself, and talk about the type of data that you bring to the table.
Well, certainly the number of patients that you're seeing
At the school?
and the insurances that they have, how many of them
Yeah.
are uninsured.
Mm-hmm, for sure.
For us, it's the amount of wellness visits or physicals and or sports physicals.
And
Anyone else?
immunizations.
I'm sorry, go ahead.
I said immunizations.
Mm-hmm. Yep, for sure. What about data or research in terms of data for your community at large? Just like, again, broadening your ideas. So what about things like the number of ER visits in your county or in your hospital, and whether that's trending up or down? Could that be helpful?
It could.
Well, we sometimes look at the number, not just the number of ER visits, but the number of preventable ER visits or preventable hospitalizations if primary care or access to dental care could have been accessed or could have been used.
For sure.
And there's author has a report that looks at that, preventable hospitalizations and ER visits.
I love that kind of information. You know, like I said, strategic planning is very data driven, but our healthcare partners are unique in that you are bringing like information to the table that nobody else has. So outside of the school building, a lot of people may not be thinking about, you know, ER visits, right? But the ER visits that are preventable can be very tied to strategic planning for community schools, because one of the things that we're hoping is that through the healthcare services that are provided in coordination with the community school, that there's more preventive health that's being done overall, right? So maybe with more preventive health, you don't have to have as many reactive ER type health visits, right? So I want you to like really think about the type of data that just flows through you as a healthcare provider and somebody in the healthcare field that could be helpful to help kind of set the stage for the type of needs that you are seeing in the community in which you're involved, right? So think outside the box. What other data may be helpful to have everybody else kind of be exposed to? All right. And then, you know, another thing to consider, of course, is the social determinants of health. And that's very closely tied to a lot of the work that we do in community schools. So, you know, economic stability, housing stability, healthcare access, food access, the amount of violence in the neighborhood, even like social connectiveness, and are there opportunities for that in the community? So there are a lot of social determinants of health. So I want you to kind of think about how can those factors also be brought into the discussion, remembering that those who sit at the cabinet table may or may not have thought through you know, because you guys are experts, you think about this all the time, but others at the table may have not really made the connection to the fact that housing stability or economic instability can have an impact on health that can be seen in the students and families of the school. All right, so other ways that you can kind of expand and think about how you can make an impact at the school is thinking about kind of the robust network that you have in the community. You have a lot of partnerships. You're talking to a lot of different organizations. You have a lot of partnerships within the community. So always thinking about, you know, how can I engage my partners to have them become involved and invested in the same outcomes that we're trying to reach for the community school? Because if they're a strategic partner of yours in the community and they're in the same community as the school, you're all serving the same people, right? So, you know, I have found that, you know, it's that ripple effect. The more that I engage the people I know in the different initiatives that they just don't even know about, the more robust of a network that you're going to build. So when you're sitting at meetings or conferences or having conversations with some of your colleagues in the community, in the healthcare world, like be thinking about, is this somebody that could be brought into the network at our community school and help with the work that we're doing? So be active in like growing that network. Also be thinking about ways that you can like enhance the educational opportunities and the trainings that are offered to staff, to students, to parents, to community members about different health conditions and wellness practices. Many of you are probably already doing that. But going back to kind of the needs assessment and some of the data, like even the example that was given earlier about preventable ER visits. Is there information that can be given in a newsletter, in a workshop, at the parent engagement type of activities that are happening at the school? Are there ways that you can get information out there about how to prevent having to go to the ER? What are other ways to get healthcare access other than the ER? You know, anything that you're thinking or you're seeing as a trend, a healthcare trend in your community, or a need that you're seeing is an opportunity to educate the community through your community partnership school connections. All right, so one of the things that we want to emphasize in terms of strategic planning is that really thinking through, okay, whatever the strategic priority is, and I put examples here. So attendance a lot of times is a strategic priority. We've got math goals, we've got reading goals, we've got like behavior or mental health goals. So really thinking through how can each pillar, so you, the healthcare, the wellness pillar, how can each pillar and how can each partner really work to address whatever that strategic goal is? So in order to kind of stretch our thoughts about it, Justine has put in, thank you again, Justine. She has put into the chat just some sample strategic plan goals that by pillar that we have created just to kind of, you know, open up your mind, stretch your imagination. I have the example of attendance on there, but the link is in the chat. So I pulled out just the wellness pillar. So how can the wellness pillar help with attendance? So we've already talked a little bit about increasing preventive care. So students don't have to leave their school in order to seek health care. So those were some examples, and taking it how do you put that goal into like an indicator that can be measured and really having the language to understand how does healthcare help with attendance. And I know sometimes, you know, when we're having conversations about why do we have the pillars, and how do the pillars help with different goals that we're trying to obtain, sometimes people have a hard time coming up with the language of why. Why are we choosing to have dentistry on campus? Why are we choosing to have workshops offered to the families when they're, you know, on campus for, you know, some family engagement activity? So I wanted to like just kind of give you examples of how they really are all tied together. I put another example up here for homelessness. Now, you know, this is not something that you're going to see in every strategic plan, but I've been involved with a lot of unhoused students in my K-12 career. So it may not be a strategic planning, but I wanted to throw it up there as just kind of a outside the box thought process about what might be a focus for strategic planning for certain schools that really are having, you know, a lot of issues with homelessness or students that are unhoused. So the wellness pillar obviously can help with the homelessness goals that could be set by a cabinet. So it could be around providing mental health supports. It could be the hygiene bags that are given out. It could be some kind of training given to students. It could be trainings given to families. So there are lots of different ways. You know, I like the idea of prioritizing, you know, like really keeping an eye on those students that we know are really vulnerable because they are homeless, and like really keeping an eye on whether their healthcare needs are being met. Sometimes, you know, you have to case manage those situations, but there's always a way, no matter what the strategic priority is, each pillar has a way of touching it. So I want you to like really open up your ideas around how can we, as the healthcare partner, use the wellness pillar to touch whatever it is that the goal is that the cabinet has come up with. Are there any questions about that? All right, so I am not going to switch back over to the Padlet again, just because the technology took me a little bit before, and it's probably, I'm not going to show it on my screen, but you can go ahead and click on the Padlet link that Justine just put into the chat. And it's a brainstorming session. So it has a couple of questions there. It's, I can support attendance goals by. So you can give your examples. I showed you some of the examples that I came up with, but my guess is that many of you on the call have been through strategic planning sessions where attendance has been the priority. So what are some of the ways that you, as the healthcare partner, are helping to address attendance at schools? So that's one of the questions. The other one is the same thing for academics. What are some of the ways that you're, through the healthcare, as the healthcare partner, through the wellness pillar, addressing academic goals of the cabinet or the strategic plan? And then the last question is ways I can increase knowledge of school students, community about health and wellness issues, whether it's you giving an example of a newsletter, or how are you maybe funneling and feeding data to the community partnership school director, who may be the one that's sending out a newsletter, but you're just giving her a little, clip to reach the eyes of the parents. So go ahead and click into the Padlet and put your thoughts in there. And I see people working, so I will give it some time. And again, if it takes too long to type, please feel free to just unmute and we can talk amongst ourselves about some of the ways that you are hitting some of these kind of common strategic goal areas.
Are you just supposed to double click on it and it will?
So if you click on, there's a plus button down in the bottom right corner
that says add comment?
Yep.
Yeah, nothing's happening.
So when you click on that
Okay,
button,
yep, something happened now. Got it. All right.
Okay, perfect. Honestly, if you're having trouble with it, I'm not about stressing, so you can put stuff in the chat if you'd rather.
Yeah, because whatever I did, it went away. So,
Or do you want to just talk about what some of the ways that you're hitting attendance?
I was hoping if I
academics, or
started
others?
typing, something would come to me.
That's okay. You know what? I appreciate your like fearlessness of let me try and put myself out there.
Huh.
So I do see someone has put in their presentations at school events to increase awareness, being present or presenting at school events like open house or freshman orientation. If you have access to different interns or college students at your healthcare organization, sometimes they are eager, but maybe a little scared, but eager to present, to kind of hone in their presentation skills. So sometimes that's a resource. I see, so supporting attendance goals by offering fun classes on bike, ATV, heat and water safety through our child advocacy team. I love that. I love the idea of like, those are fun and engaging type of topics. And thinking about those in addition to the kind of more standard health ones like, addressing blood pressure issues, or even ones about like stress, right? Helping people to understand the like the neurology behind stress and the hormonal effect of stress, and how can you help yourself to become less stressed, and how I've done a lot of, I've done a lot of presentations and research on how stress affects your internal organs and your body overall. And I used to do a lot of presentations to parents on that because I think that a lot of times we just think stress is stress and we don't understand it's actually very hard on our internal body systems. Okay, you can keep working on that Padlet if you would like. But that is the last of the content that I have for you. But I want to open up the floor to anybody that has questions about strategic planning and or if you want to share ideas, because this is a time for you to be able to pick the brains of your colleagues across the state. We definitely want to create a network that's robust where everybody is elevating their practices because they're hearing all the wonderful things that other people are doing across the state. So I want to open up the floor. And while I'm opening up the floor, I want to, is that slide not showing up? I wanted to share our evaluation survey. And it's, I don't know, something weird is going on that my slides are not showing completely up. So I'm with you. My technology is not helping today. But Justine, are you putting in the chat the evaluation link, please? I would appreciate it.
Yes, I was going to say that there were some questions that were in the KWL
Okay.
Padlet. I don't know if you wanted to go over that, but I'll put the survey link in the chat too.
Okay. Do you happen to have the KWL still up? Because I closed it, of course. And
Yeah, I can share my screen.
oh, okay. Tag team, right?
Mm-hmm.
Please stop sharing. All
You're able
right.
to see the KWL chart, correct?
Oh, I am, but it's super small. But I actually, in the meantime, was able to click in. But feel free to help me to monitor this, Justine, and Tawana. So what is expected of us during strategic planning and what are best practices? So what's expected of you is kind of the stuff that I've been talking about in terms of like bringing your lens as a healthcare provider to the table. So again, you have the expertise in healthcare in your community. You have the expertise in what's going on. What are, things like trends in Medicaid and trends in health insurance and what's happening in your hospitals and ERs. And so you have all of this knowledge. So the kind of using all of that knowledge to help the schools to understand how these things may be impacting what's going on with students, what's going on with their parents or families, because if it's happening in the family life, it's affecting the student and what they bring to school. So definitely thinking about like, what is the data? What are the trends? What's happening in the healthcare world in my community? And then bringing your ideas about like so we threw up those examples of how you can use the healthcare partner or the wellness pillar to address almost any strategic planning goal. So really, again, using your expertise to think through, okay, so how can I, as a healthcare partner, really help to address maybe reading issues, right? So, and you might have to like really, really walk it back. And it's okay if you don't have the answers. Just kind of bringing that thought up to the cabinet and saying, I'm not sure. I would love to hear ideas from the rest of the cabinet, but what are your ideas about how I can help kids to read better, right? And it could be a way off the wall thing. It could be that you're providing, more children's books in the waiting room at the ER, or you have a student intern that is reading to students or youth as they're waiting with their families for procedures in the ER. Like it could be like, I really want you to open up your mind and really think about how you as the partner can help impact any of these goals. So that is your role. That's what's expected of you. How I think I already talked about how often it's required, every 2 to 3 years. So how do the partners provide input? So that's going to be probably different at every school. Typically, strategic planning is something that kind of gets organized by the community school director, and a lot of times in cooperation with the principal. So they may be leading out some of the meeting, or whoever the cabinet chair is, they may be leading out the meeting, but you definitely want to figure out what your platform is going to be for sharing your ideas. And if they haven't given you the floor to ask you about, you know, how you can contribute to the different goals or contribute to the ideas, just speaking up and talking about kind of what's been going through your head as you're preparing to go into this. SMART goals. I don't know if Dr. Rollins is on here. I always forget these, and she was just talking about this earlier, but it's specific, measurable. Oh my gosh.
Attainable, relevant, and time
Attainable.
bound.
And then you added a Y to your SMART goals to make them SMARTY goals, which I really, really like. Do you want to explain what the Y is?
The why is to make sure that they yield results.
And we've really been focused on that a lot lately. Like, we want to make sure that we are intentional and strategic in what we do, and that we're making sure that it does yield results, right? So SMARTY goals, I love that. Okay, I think that goes through all of the questions. Any other remaining thoughts or questions?
Can I give a suggestion for when the principals are unwilling to meet to discuss wellness reports? I would
Please,
also
yes.
suggest to bring it up to the cabinet because wellness affects attendance. I come from an education background, and so usually if we talk the language of the principal, then they will see how what you guys do supports the school. And so I would say find correlations and even in their school improvement plan in the cabinet and how you can support them to have student success, which will increase school, not school grade, but that's not the focus, but the overall success of the students. Because if they're missing school, they're losing out on test scores, they're not the learning gains are lower, decreased. So these are or even in behavioral because of stress, like I don't know if we're allowed to things that are going on internally with students, whether through their brains or physical stuff. Like I would just find along the lines of the trends of what's going on with the families, what's going on with the community, and correlate it with the school improvement plan and how do they both align? Because to fidelity of the model, wellness is a pillar that is needed in order to see success with the students in the school. So just emphasizing that as well with your cabinet. And then I would suggest if there's no movement there, feel free to reach out to one of us and we can provide more resources and find out how we can support you to make sure that it is being incorporated since it is fidelity to the model. So I just wanted to suggest that. I was going to write it. I was like, let me come off mute.
Thank you for that, Justine. As you were talking about that, another thing that just popped into my head, and I know not everybody on the call is from a hospital system, but again, you are, in the healthcare kind of world. So another thing that is valuable information that schools may or may not be aware of is, are you seeing trends related to domestic violence increasing as you are seeing, people through the healthcare community? Because if schools are aware that it's trending up, they definitely they can communicate that information with their staff to begin to think, okay, so what can I do? So sometimes you're bringing information, but that doesn't mean that you're the one solving the problem with your program or your service. It means that the information is something that they can consider, and it may be something where they put more education into their health curriculum itself, to address domestic violence issues. You may see that there's more dating violence that's happening with teenagers in your community. And again, if you bring that to the table, they may want to adopt some different supports and services within the school system. It doesn't mean you have to provide it, but it's good information to know. So that is all that I have for you today. I do believe, did you put the evaluation? I'm not seeing the link for the evaluation in the chat. Am I just missing it? Oh,
Sorry,
thank you.
no, I got
No,
it.
please don't be sorry. You helped me with all this technology. I appreciate it. Thank you for your time today. I appreciate all of you. Have yourself a restful weekend. I really hope that you all, have some extra time off. That is my hope for you. And again, contact us, any of us, if you are not getting the emails. And yep, our information is right there on the screen. Jot it down if you need it. And we will see you at the next call. Thanks for joining today.